Hi, I'm Carla Robinson, CEO and co-founder of Canary Telehealth. And we have lots of programs. The one we're really excited to talk about today is our patient engagement program. It's a self-management program where patients get a device to measure their readings and an app that guides them through much of the content related to Life's Essential 8. So they have an opportunity to ask questions, or we'll ask them questions and find out barriers that they may be experiencing. And then we're able to deliver the content relative to that in the context of the barrier that they've just described. So we're super excited about that. We've had lots of great results, good participation on the program, and Life's Essential 8 content has just made the education process for us so incredibly powerful. Great. So they get an app on their phone, and it starts out with just a welcome. It introduces them to what the Life's Essential 8 elements are. It orientates them on how to take a proper blood pressure reading and what to expect on the program. And then on a daily basis, when they engage with the app, they're asked questions. For example, did you take your medication? If not, why not? And they may disclose, because I had problems getting my prescription refilled. And then we'll give them advice on that, pointing them back to their doctor. Or we'll ask them, how have you been doing this week in adhering to your low sodium diet? And they may tell us the reasons they had challenges. Oh, whenever I go to work, it's really tough. And so we play American Heart Association content for them on sneaky sodium at work. So mostly it's self-management, and it's through automated feedback. So we have the logic already built in based on what they say, what's the content that they get, or and sometimes what's the follow-on question that they might get that then leads ultimately to the right content. That being said, at some point, sometimes people need to talk to somebody. And so we have the ability for them to message us and say, I've got questions, I need help. And the other reason that people reach out to us is because we invite them to tell us about any needs that they have as it pertains to social determinants of health. So if people say that the reason they didn't get their medication is because they had transportation issues, we'll invite them to talk to us so that we can help them navigate that. So what we're super proud of is and excited about the ability of the app to provide that education that it maybe have been a long time since they went to the doctor. They may have had a limited interaction during that time frame. And they may not, how you have questions and then when you go to the doctor, you can never remember to ask the questions anyway. And so this provides an opportunity to engage them and address some of their issues throughout the year. And then there are times where very often the advice or the guidance is to consult your doctor on that, right? And so that we're pointing them back to their doctor, but now they have the confidence that this is a topic that I should consult my doctor about, right? And now they so they can be more selective about those kinds of things. So a couple of things that we're super excited about is we have all the claims data that shows us the reduction in hospitalizations. We have the biometric data that shows us the reductions in the improvement in blood pressure control. What really excites us is, in addition to that, is the self-reported information from the patients that say, wow, I now understand what my numbers mean. I have better conversations with my doctor because I can engage him more, right? And so those are the kinds of things that really excite us, and we're happy to help in that way. We do. So our greatest population truly is underserved. So we do a lot of work in Medicaid expansion. And so a lot of people that we have on our programs, they're fairly new to the healthcare system. And so we're able to meet people where they are. So a lot of times it's educating someone on how to download an app. And then we walk them through saving their doctor's phone number into their telephone. So when we say, contact your doctor about that, it's easy and seamless for them to do that. We not only in the beginning do we ask about social determinants of health issues, but it's baked into, just like we ask about their blood pressure numbers, we ask about food insecurity, housing insecurity, and things like that. So what I would say is, I wish we had found it sooner. We have worked for a really long time. So we've been in the telehealth space since 2010. We've worked for a really long time getting content from here or there. and we have our own internal team, and everything that we would want to educate someone on as we're helping people manage their chronic conditions is truly in the content of the American Heart Association. So all we have to do is think about what is the use case or the scenario that we're trying to support someone in, whether it's smoking cessation or whether it's medication adherence or ways to get more physically active. And we can find answers to that and scientific-based knowledge on guidance for that.